continues to face an incredibly serious situation with this third wave. Cases are rising rapidly. In many cases, in many places, numbers are higher than they've ever been before, and far too many hospitals are stretched way too thin. In Toronto in particular, numbers are breaking record after record, and ICU hospital beds are filling up. There's no doubt that Canada's largest city is struggling under the weight of this third wave, so we're going to do whatever it takes to help. On vaccination in particular, Ontario has reached out for more support. I can tell you today that we are standing by to deploy the Canadian Red Cross to help with their mobile vaccination teams. This is about getting doses to people where the situation is most serious. And we'll also continue to help on a whole range of other fronts, too. Discussions are ongoing about extra healthcare providers, and we are ready to step up. We've also already deployed mobile health units that set up more hospital beds in Toronto and Hamilton. For Ontario, we've shipped out more healthcare equipment like oxygen units and drugs to treat COVID-19. We have approved a request to have the Canadian Red Cross deployed in up to 27 long-term care homes as needed. We're supporting safe isolation sites everywhere from Toronto to Peel to Thunder Bay. And we have deployed 300 contact tracers doing thousands of calls a day for Ontario, and lab support, which has already processed over 15,000 samples so far. Yesterday, I spoke with Mayor Crombie of Mississauga, Mayor Tory of Toronto, and Mayor Brown of Brampton. We talked about what's going on in the GTA and what that means for hospitals, schools, and small businesses. We also talked about the fact that this is a moment when we all have to work together to flatten the curve while getting vaccines into arms as quickly as possible. Earlier this morning, I also spoke with Mayor Scarpitti of Markham. I told him what I told the other mayors last night, that our government is here to help. And that's true for every community in Canada. No matter where you live, know that we have your back. We're supporting COVID-19 testing for people in BC, Alberta, and Manitoba through mobile labs that can reach more patients. We're providing help on isolation sites in places like Nova Scotia and Saskatchewan to stop cases spreading. And across the country, we've stepped up with money for school safety, shipped out PPE, and of course, delivered vaccines. The frontline workers, people working in hospitals, those they're caring for, and their families, know that we have your backs, even as you have ours. You've been heroes throughout this pandemic, stepping forward to help all Canadians. We recognize that. We continue to be there for you. You don't have to face this alone. We will support you and your families as you keep us all safe. Thank you for what you're doing. And to all Canadians, I know you're exhausted. I know you're all sick and tired of COVID-19. I know nobody wants to be in this third wave. Nobody wants to be facing further restrictions. We just want to be done with this. But we know how to do what we need to do. We need to follow the public health rules. We need to hang in there and hunker down for a number of more weeks. Nobody wants to do this. I got in an argument with my 13-year-old this morning who doesn't want to do this. Nobody wants to do this. But we know that if we hang in there, hunker down, and follow the rules for the coming weeks, as much as we're tired of them, as much as we're frustrated, we have a chance of getting to the summer in much better shape. This is a moment for us to dig deep at what is hopefully the very late stages of this pandemic for us all and make it through. It's time to show our neighbors and our loved ones what we're all made of as we keep people safe. La semaine passée, J'ai répété au premier ministre des provinces et territoires qu'on est prêt à leur offrir tout le soutien nécessaire. On traverse actuellement une période très grave de cette crise. C'est important qu'on continue de travailler en équipe parce qu'ensemble, on va passer à travers. On vaccines, while we, like many other countries, have been impacted by manufacturing challenges at Moderna's European facility, this morning I have some very good news to share about Pfizer. Canada has now signed an agreement with Pfizer for 8 million more doses of the vaccine. This is on top of what we have already purchased. I want to thank everyone at Pfizer for their cooperation and hard work, not just to keep deliveries on schedule, but to move more doses up and reach new agreements. With the new deal, Canada will receive 4 million additional Pfizer doses in May, another 2 million in June, and 2 million more in July. For next month alone, this will come out to about double the Pfizer doses we were originally expecting. All told, we'll be receiving 8 million doses in May and almost 12 million in June from Pfizer alone. Now, that's a lot of numbers, so here's the bottom line. More doses arriving sooner means more people getting their vaccines faster. And that means more people who are safer and more families that can breathe a sigh of relief. Le Canada a maintenant conclu une entente avec Pfizer pour obtenir 8 millions de doses supplémentaires qui s'ajoutent à celles que nous avions déjà achetées. Grâce à cette entente, on va recevoir 4 millions de doses supplémentaires au mois de mai, 2 millions de doses supplémentaires en juin et 2 millions de doses supplémentaires en juillet. En résumé, ça veut dire qu'on va recevoir environ 2 fois plus de doses de vaccin Pfizer que prévu pour le mois de mai et des millions de plus en juin. On travaille sans relâche pour que chaque Canadien puisse se faire vacciner le plus tôt possible. Je sais que bien des gens, particulièrement des jeunes, attendent patiemment leur tour pour que leurs grands-parents, leurs parents et les travailleurs de première ligne puissent se faire vacciner en premier. Merci et tenez bon. Vous allez recevoir vos doses bientôt. On est en bonne voie pour vacciner complètement tous ceux qui le souhaitent d'ici la fin septembre. Je sais que ce printemps a été difficile, mais l'été et l'automne seront meilleurs si on tient bon et surtout si on suit les règles de la santé publique. Remember that this won't last forever. There's every reason to believe that we're now in the final, although toughest, stretch of this pandemic. This is not the moment to let up, not even for a second. So no matter where you live, keep your distance, wear a mask, stay home whenever possible, wash your hands, download and use the COVID Alert app, and be sure to follow local public health guidelines. Hang in there a little longer because we're going to get through this. C'est tout à fait normal de ressentir de l'anxiété ou du stress en ce moment. Vous n'êtes pas seul. Votre santé mentale est importante et il y a des gens qui peuvent vous aider. Si vous éprouvez des difficultés, n'hésitez pas à demander de l'aide. Il y a 1 an, on a lancé le portail en ligne Espace Mieux-être Canada. Le site Web offre un soutien gratuit et confidentiel en matière de santé mentale et de consommation de substances, 24 heures sur 24, 7 jours sur 7. En 1 an, plus de 1,2 million de personnes d'un bout à l'autre du pays ont utilisé cette ressource. Il n'y a pas de honte à avoir besoin de parler à quelqu'un ou de demander de l'aide. Alors que vous soyez à la recherche de conseils, de ressources, de renseignements fiables ou d'un soutien immédiat, vous pouvez toujours vous rendre sur le site de l'Espace Mieux-être Canada pour trouver de l'aide. Whether on vaccines, healthcare resources, or mental health support, we're focused on what you and your family need to get through this crisis. On that note, this Monday, we will be releasing our 2021 federal budget. In the last few days, I've had meetings with all of the party leaders to discuss that budget. As I said to each of them, it's vital that we work together right now. This is especially true on measures that are about helping you get through this pandemic, whether you're a parent, a student, a small business owner, or a senior. On aura plus de renseignements à vous fournir lundi prochain au sujet du plan qu'on met en œuvre pour assurer la sécurité des Canadiens, créer des emplois pour la classe moyenne et rebâtir une économie propre et résiliente. Mais pour l'instant, je veux simplement vous dire ceci. L'ensemble des mesures prévues dans ce budget ont pour but principal de vous aider à traverser cette crise et de rebâtir un Canada plus fort pour tous. Finally, I just spoke with Her Majesty the Queen to extend my deepest condolences and the condolences of all Canadians on the passing of His Royal Highness the Duke of Edinburgh. She expressed to me how touched she was by the tributes that have been flowing in from Canada and around the world for Prince Philip. And she highlighted and remembered for me all the fond memories she holds of trips to Canada with him over the past many decades. Prince Philip's legacy of service will be long remembered here in Canada, especially in his work to empower young people. Merci tout le monde. Thank you. I'll pass it now to Minister Anand. Anita.
Thank you, Prime Minister. Good morning, and thank you all for joining us today. I will take just a few moments to expand on the additional Pfizer deliveries that are coming to Canada in May and June, as well as provide some other vaccine updates and how they fit into the overall vaccination campaign. À ce jour, plus de 12 millions de doses ont été livrées au Canada et nous collaborons activement avec nos fournisseurs pour accélérer et renforcer les calendriers de livraison. Ce travail porte fruit. Par exemple, au départ, nous devions recevoir 6 millions de doses de vaccins avant la fin de mars. Nous avons dépassé cet objectif de 3,5 millions de doses et en avons reçu 9,5 millions. As the Prime Minister has just announced as well, this week we have secured an additional 8 million Pfizer vaccine doses under our agreement. The first 4 million additional doses are scheduled to arrive in May, followed by 2 million doses in June and 2 million more doses in July. In addition to this, Pfizer is also moving another 400,000 doses from the third quarter into the month of June. Thus, the delivery schedule for both May and June will see approximately 2 million doses of Pfizer coming into the country every week, and indeed in June, that amount will be more. There will be 12 million doses spread over the 5 weeks in June. The total is going to be 24 million doses between April and June from Pfizer alone. That is excellent news. C'est une excellente nouvelle pour la population canadienne. Cela veut dire que nous allons recevoir plutôt plus de doses de vaccins du Pfizer et ce en plus des millions de doses des autres vaccins que nous attendons déjà. Comme je l'ai souvent indiqué au sujet de l'équipement de protection individuelle et aujourd'hui des vaccins, le marché mondial demeure très compétitif et volatile. In this vein, as Moderna indicated this morning, it faces ongoing challenges with ramping up production to meet intense global demand due to labor shortages and other issues. As a result, our next shipment will be smaller than expected, and we may see additional delays over the coming months as Moderna's production capacity continues to increase. This news is obviously very disappointing. Our government will, however, continue to bring vaccines into the country in the face of volatile supply chains. Remember that a year ago, vaccines didn't exist for COVID-19. Supply chains and manufacturing systems did not exist either. We will continue to press Moderna and all of our other suppliers to do everything possible to respect their delivery targets and to provide more consistent delivery schedules. I can now also provide an update on anticipated deliveries of Johnson & Johnson's vaccine and AstraZeneca. Canada will receive an initial shipment of approximately 300,000 doses during the week of April 27th to be delivered to the provinces at the beginning of May, with more substantial deliveries coming in the latter part of this quarter and into the summer. For AstraZeneca, Canada is still expected to receive 4.1 million doses from all sources by the end of June, with further deliveries in the third quarter. Indeed, I spoke with AstraZeneca executives this morning and am pressing for more AstraZeneca doses to Canada in the coming weeks and months ahead. In total, Canada will receive between 48 to 50 million doses of vaccine by the end of June. Despite the temporary and short-term fluctuations in deliveries from our suppliers, Canada's vaccination campaign overall is gaining ground. We are currently ranked 4th among G20 countries for doses administered per capita, and 2nd in the G20 when it comes to the average number of doses administered daily per capita. Cela dit, ne vous méprenez pas. Malgré tout ce progrès, il reste encore beaucoup de travail à faire et notre gouvernement entend bien veiller à ce qu'il soit fait. Les prochains mois seront déterminants. Tous les Canadiens et Canadiennes doivent faire leur part et continuer de suivre rigoureusement les consignes de la santé publique pendant que la vaccination suit son cours dans tout le pays. Our government will do its part by continuing to support Canadians in our time of need. And I can tell you that my team and I will do whatever it takes to ensure that an accelerated flow of vaccines will keep coming into this country. At the end of the day, I'm a mom with a spouse and 4 kids and 3 dogs. I feel the urgency, like everyone else, to get vaccines to Canada as soon as possible. Every day, my team and I are ensuring that our delivery of vaccines increases for the benefit of all Canadians. Merci beaucoup. Thank you. Miigwech. Dr. Tam?
Bonjour. Bonjour. Hello. Good afternoon and bonjour à toutes et à tous. So to date, over 1,096,000 cases of COVID-19, including 23,500 deaths have been reported in Canada. Over the past week, there have been an average of over 8,600 new cases reported daily. During the same time, the number of people experiencing severe and critical illness continues to rise. On average, over 3,400 people with COVID-19 were being treated in our hospitals each day, including almost 1,500 people being treated in intensive care units, representing a 34% and a 22% increase, respectively, compared to the prior week. Unfortunately, we're now beginning to see an increase in the mortality trend, with an average of 41 deaths reported daily over the past week, which is a 38% higher than the week prior. There are over 51,600 variants of concern cases reported to date across Canada, with the B117 variant accounting for almost 96% of these. On this final or last stretch through this crisis, we can also gain strength from good news and focusing on the things we're grateful for. We have been heartened by the many ways Canadians are helping to support COVID-19 vaccination efforts. Since April is the Sikh Heritage Month, we'd like to highlight an example we recently learned about from that community. Sukhmeet Sachar, a UBC, University of British Columbia, medical student, has been working together with the Sikh Health Foundation and a team of volunteers to translate and share information about COVID-19 with Punjabi-speaking seniors in the Fraser Health region. Their efforts are helping to support community members to make an informed decision on vaccination and at the same time dispelling misinformation. This week, we were also grateful to be among the over 7 million people in Canada who have received a first dose of COVID-19 vaccine to date. And the good news is that vaccines are reducing severe illness, deaths, and outbreaks in high-risk settings and populations that were targeted in our initial phase of vaccinations. Though we all need to keep following public health advice and maintaining our well-practiced precautions as vaccines roll out further, these benefits are building, and they will be the bridge that takes us all to greater safety and back to the things we have missed so much. Thank you.
Bonjour à toutes et à tous. À ce jour, plus de 1 096 000 cas de COVID-19, dont 23 500 décès, ont été recensés au Canada. Au cours de la dernière semaine, en moyenne, plus de 8 600 nouveaux cas en moyenne ont été signalés chaque jour. Au cours de la même période, le nombre de cas graves et critiques de la maladie continue d'augmenter. En moyenne, plus de 3 400 personnes atteintes de la COVID-19 ont été traitées dans nos hôpitaux chaque jour, dont presque 1050 personnes étaient traitées dans des unités de soins intensifs, ce qui correspond à des augmentations de 34% et de 22% respectivement par rapport à la semaine dernière. Malheureusement, nous commençons à observer une augmentation du nombre de décès. La moyenne se chiffrant à 41 décès au cours de la dernière semaine, soit 38% de plus que la semaine précédente. Nous enregistrons plus de 51 600 cas de variants préoccupants à ce jour au Canada, le variant B117 représentant presque 96% des cas. Durant ces derniers efforts vers l'issue de la crise, il est possible de retrouver des forces en apprenant de bonnes nouvelles et en nous attardant aux choses qui suscitent chez nous un sentiment de reconnaissance. Nous avons été ravis de voir de nombreuses façons dont les Canadiens appuient les efforts de vaccination contre la COVID-19. Puisque le mois d'avril est le mois de patrimoine sikh, nous aimerions souligner un exemple dans cette communauté qui a récemment été porté à notre attention. Sukhmit Sachal, un étudiant en médecine de l'Université de la Colombie-Britannique, collabore avec la Sikh Health Foundation et une équipe de bénévoles pour traduire les renseignements sur la COVID-19 et les diffuser aux aînés qui parlent punjabi dans la région sanitaire du Fraser. Ce travail permet d'aider les membres de la communauté à prendre des décisions éclairées au sujet de la vaccination tout en empêchant les mésinformations. Cette semaine, nous sommes aussi reconnaissants de faire partie des 7 millions de personnes au Canada qui ont reçu à ce jour la première dose de vaccin contre la COVID-19. Or, la bonne nouvelle, c'est que les vaccins permettent de réduire le nombre de cas graves de la maladie, de décès et d'éclosions dans les milieux et les populations à risque élevé qui avaient été ciblées durant la première campagne de vaccination. Mais pourtant, nous devons tous continuer à suivre les conseils de santé publique et à appliquer les mesures de précaution bien ancrées dans nos habitudes, tandis que nous continuons de procéder à la vaccination. Les vaccins continuent de faire effet et ceux-ci permettront d'atteindre le moment où nous serons en sécurité et nous pourrons à nouveau profiter des choses qui nous ont tant manqué. Merci.
Merci, Dr. Nou. On va maintenant passer à la période des questions en commençant par le téléphone avec une question suivie. We'll then go to the room. Please note that Minister Anand and Dr. Tam will have to leave at 12:30. Opérateur, c'est à vous.
Thank you, merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur l'étoile 1 maintenant pour poser une question. The first question is from Marika Walsh of the Globe and Mail. Please go ahead. Your line is open.
Good morning. Thanks so much for taking our questions. Prime Minister, my question is for you. The Canadian Medical Association is calling on the federal government to change its vaccine allocation and to now start allocating vaccines based on needs in region and not based on per capita. Will your government do that?
Thank you, Marika. These have been conversations we've had ongoing with the provinces over the past many months. Working with the provinces, we arrived at a per capita allocation formula with a carve-out for the northern territories to make sure that they could get rapidly vaccinated because of the level of vulnerability. But of course, we're happy to continue to work with the provinces on adjustings as the provinces see necessary. Depuis les débuts, nous avions travaillé avec les provinces et territoires pour assurer une allocation équitable de vaccins à travers le pays, avec une exception faite pour plus de vaccins pour le Grand Nord où il y a particulièrement de vulnérabilité. Mais évidemment, nous sommes toujours ouverts avec des discussions avec les provinces pour modifier les allocations si ça leur intéresse.
Thank you. So should I take from that you do not personally support changing the current allocation method from per capita? And my next question is on the request from Ontario for 600 critical care staff. Does Canada have that slack in the system that it can send Ontario 600 critical care staff? And if not, are we talking to the U.S.?
We are extremely preoccupied with the situation right now in Ontario, and as I told mayors last night, as I've told my members of Ontario Caucus, and as officials have been engaged back and forth with the Ontario government, we are there to help. We look forward to delivering any and all supports that they need. Those conversations are extremely live right now and ongoing. I know there's also been discussions about healthcare resources from other provinces turning towards Ontario. These are all the things that we're working very, very hard on right now to respond to the extremely difficult situation in Ontario. Les conversations continuent, évidemment. Nous sommes très, très préoccupés avec la situation en Ontario et ailleurs au pays, mais particulièrement les conversations que j'ai eues avec nos députés de l'Ontario, avec différents maires et les conversations qui sont constantes entre mon bureau et le bureau du Premier ministre Ford. Nous allons être là pour aider. On est en train de travailler sur exactement c'est quoi l'aide dont ils ont besoin. Mais je peux aussi souligner qu'il y a des discussions avec les autres provinces aussi pour allouer plus de ressources pour aider dans cette crise particulièrement urgente en Ontario.
Merci. Next question.
Thank you, merci. La question suivante est de Mélanie Marquis de la Presse. La parole est à vous.
Merci. Bonjour, M. Trudeau. Je comprends qu'on reçoit les 300 000 premières doses de Johnson & Johnson le 27 avril, selon ce que votre ministre disait. Dans quelle mesure est-ce que le fait que le vaccin est suspendu temporairement aux États-Unis change la stratégie sur le plan de l'approvisionnement? Est-ce qu'on en tient compte ou pas du tout?
On continue de s'attendre à recevoir ces doses au fin du mois d'avril et les autres doses par la suite. En même temps, évidemment, on va suivre attentivement tous les conseils de Santé Canada par rapport à ces doses-là. On va toujours se fier sur les recommandations des experts par rapport à la sécurité et la santé des Canadiens. Mais peut-être que je peux passer la parole à la ministre Anand, qui en a peut-être à ajouter.
Oui, merci beaucoup, Monsieur le Premier ministre. Oui, nous travaillons très fort avec le fournisseur maintenant pour apporter les doses de J&J ici au Canada, et ça, c'est notre priorité. En même temps, nous suivons l'information de Santé Canada, et à ce moment-là, la priorité pour notre gouvernement est d'avoir plus de doses plus vite ici au Canada. Merci.
We are focused on receiving as many vaccines as possible, as quickly as possible in this country. We're expecting a delivery of the J&J vaccine at the end of April. Of course, before those vaccines are distributed, we will ensure that Health Canada is continuing to approve this Janssen vaccine for use safely in Canada. We will always put the health of Canadians first and foremost.
En suivi, Mélanie?
Oui, sur un autre sujet complètement, il y a les conservateurs hier qui ont annoncé leur plan climat. Il y a une tarification carbone. Croyez-vous maintenant, en prévision de la prochaine campagne, avoir un adversaire qui prend les changements climatiques au sérieux? Puis je sais que le plan est vaste, mais pouvez-vous me dire ce que vous pensez précisément de ce que le Parti libéral appelle les pétropoints, donc l'espèce de carte carbone que les conservateurs proposent?
D'abord, les gens attendent depuis longtemps que le Parti conservateur prenne au sérieux les changements climatiques. Malheureusement, ils vont devoir attendre encore longtemps parce que ce qu'ils ont présenté hier, c'est pas un plan. Tout d'abord, ça va rendre ça moins cher de polluer. Ça va amener plus de coûts aux familles et ça ne va pas réduire nos émissions au niveau dont on a besoin. Nous, ça fait 5 ans qu'on prend les changements climatiques au sérieux. Nous allons continuer d'être ambitieux, mais nous allons aussi continuer d'assurer qu'on aide les familles à pouvoir avancer dans un monde qui a besoin de moins en moins d'émissions de carbone. Nous, on a un plan sérieux. Ce que les conservateurs ont mis de l'avant, c'est pas sérieux. Ça encourage les gens de dépenser plus pour les carburants fossiles et leur donne des récompenses pour ça. Canadians have been waiting a long time to see the Conservative Party take seriously the fight against climate change. And unfortunately, with what they put forward yesterday, Canadians are going to still wait a long time to see the Conservative Party get serious about climate change. The plan, the approach, the pamphlet, not the plan, that they put forward yesterday actually makes it less expensive to pollute, makes it more expensive for Canadians, and will not fight climate change and reduce emissions nearly enough. With Erin O'Toole's carbon tax, the more you burn, the more you earn. That doesn't make sense to anyone. We're going to stay focused on a real plan that not only is ambitious and stringent against carbon emissions, but supports businesses and families by returning more money to average families across the country, and indeed creates jobs and economic opportunities as we know the world is moving in that direction.
Last question over the phone.
Thank you, merci. La prochaine question, the next question is from Ryan Tumulty of the National Post. Please go ahead.
Yeah, hi there. Moderna's news that they are cutting their shipment and that they might miss their quarterly target. I know previously they had said that it was a quality control issue. Now they are saying that there's a bit of a supply problem. I'm wondering if your level of trust in this company's ability to deliver is shaky at all.
We have been extremely well served by Pfizer that has been delivering every week 1 million doses of vaccines, and we are seeing that double next month with millions and millions more in the month of June. So that is reliable and will consist of the bulk of the vaccinations that we're going to be giving to Canadians in the coming months. We are concerned about the delays and the production challenges around Moderna, but perhaps I can turn to Minister Anand to speak more directly on Moderna.
Okay, well, thanks, Prime Minister. I think we should go back to our diversified portfolio of vaccines, and we have seen that various suppliers have ramped up at different paces. And Pfizer, as the Prime Minister mentioned, is very reliable in terms of the supply that we are receiving. Moderna is still ramping up, and that is the reason for the reduction in the next shipment, for example. But I do want to emphasize that Moderna did meet its first quarter targets, and it is still possible that we will be on track for our second quarter deliveries. Having said that, we are going to press Moderna going forward to make sure that Canada's voice is known and heard, and that we very much expect them to meet their quarterly delivery targets. We appreciate the difficulties that the company is experiencing, but again, from our government standpoint, we are still seeking to ensure that the quarterly deliveries are there, just as we did in the first quarter of this year. Thank you.
Okay. Nous nous attendons à ce que Moderna atteigne ses objectifs et ses promesses pour les livraisons de vaccins au deuxième trimestre, comme ils l'ont fait pour le premier trimestre. On reconnaît à quel point ils font face à des difficultés de production. On est chanceux d'avoir un portfolio diversifié qui nous permet de compter, par exemple, sur Pfizer, qui est en train d'augmenter ses livraisons de façon significative. Mais nous allons continuer de travailler avec Moderna pour assurer qu'on reçoive le plus de doses le plus rapidement possible.
Follow-up, Ryan?
Yeah, sir, I'm just wondering, too, now that you have these additional Pfizer doses committed, it would seem that you might be able to move up your target of vaccinating everyone by September. I'm wondering if you think that's possible, if you think Canadians will be vaccinated earlier than that. Also wondering if you're going to try to do more about vaccine hesitancy now. Certainly, we've seen a lot of that with AstraZeneca, and now that we have a more robust supply, I think that might become more of an issue.
As we pointed out today, we're well on track to reaching in the upper 40 to 50 million doses by the end of June. That means, on the math of it, many or most Canadians will have been able to receive a first dose of the vaccination. That, of course, depends very much on provincial decisions on pacing and on target populations. We know there are a number of Canadians who will get 2 doses, but many others will have gotten their 1 dose by the end of June. That is part of the strategy and the recommendations laid out by our National Advisory Council on Immunization. We're going to continue to try and accelerate doses to Canada, but the one thing we have been firm on and are able to reassure everyone on is that all Canadians who want a vaccine will be able to be vaccinated by the end of September.
Merci. On va maintenant passer aux questions dans la salle.
Oui, bonjour, M. Trudeau, Louis Blouin de Radio-Canada. J'aimerais vous poser une question plus spécifique sur la demande de l'Association médicale canadienne. Tantôt, vous avez dit que vous êtes ouvert à voir pour une réallocation des vaccins en fonction des points chauds, mais pouvez-vous me dire spécifiquement où en sont les discussions avec les provinces? Est-ce que vous sentez une ouverture des provinces de peut-être, je ne sais pas, moi, en envoyer en Ontario, par exemple, ou au Québec? Quel genre de réponse vous avez eu? Parce que c'est dans vos plans.
On a établi une formule d'allocation équitable de vaccins en discussion avec les provinces. Pour changer cette formule-là, il faudrait que les provinces soient d'accord. Je peux vous souligner qu'il y a des discussions préliminaires. C'est certainement une priorité pour certaines provinces de pouvoir en recevoir plus, mais on sait très bien qu'il y a des préoccupations par rapport à la COVID à travers le pays. Donc, nous allons continuer ces discussions.
David?
David Aiken, Global News. Good morning, Prime Minister. I want to talk about the government of Ontario. So just quickly, my understanding is the government of Ontario has not made any request for federal assistance, and that today you're responding with some initiatives, possibly at the request of mayors. So I wonder if you could confirm that. And then 2, do you have confidence that the government of Ontario is acting in the best public health interests of its citizens?
Throughout this crisis, every order of government has been doing everything they can to protect Canadians, to help Canadians, to work together. Since the beginning of this pandemic, we've had close to 30 First Ministers meetings in which we have all shared our preoccupations, our concern, our priority, and our desire to work together to make sure that Canadians are kept safe and that we get through this as quickly as possible. There are things that we can and must and have been doing together, and there's always more that we can do together. As a federal government, we have a number of different responsibilities, including procuring and paying for vaccines, but also delivering PPE, providing surge support on contact tracers, on the Canadian Red Cross, even the Canadian Armed Forces. We are there to help, and what we have said repeatedly to all premiers is that we are there to help whatever is necessary. I made a promise to Canadians. I would have Canadians' backs, and that's exactly what I have. We have been discussing closely in an ongoing fashion with the Ontario government, with various officials. We have received a draft request from the Ontario government. We're going to continue to work with them on whatever they need, and we're going to continue to put forward ideas about how we think we can better help. This is a moment where all hands are on deck, and we're all working together to get through this difficult third wave.
Prochaine question.
Bonjour, Boris Proulx du Devoir. On comprend qu'on va voir la couleur des premières doses de Johnson & Johnson pour mai. À quoi les provinces peuvent s'attendre? Est-ce qu'on s'attend à ce que Santé Canada donne son approbation, puisqu'on sait que le vaccin est suspendu aux États-Unis, ou est-ce qu'on peut s'attendre aussi à ce que ce soit réservé à une partie de la population, par exemple AstraZeneca et les 55 ans et plus?
Comme vous savez, Santé Canada a déjà approuvé l'utilisation du vaccin Janssen. Évidemment, on continue de suivre très attentivement la rentrée de données de l'international sur toutes les différentes doses et vaccins. On est conscient évidemment de la décision des autorités américaines par rapport à Johnson & Johnson. On va continuer de suivre les conseils de Santé Canada, mais je pense que les gens comprennent qu'on préfère pouvoir avoir l'option de livrer ces doses-là. On va accepter et prendre livraison des 300 000 doses de Johnson & Johnson au fin du mois d'avril. Et à ce moment-là, on va suivre les recommandations les plus à jour de Santé Canada et de notre Comité national sur l'immunisation.
Next question.
Ansay Prime Minister, Krishnash Katesi, TV National News. Ontario, you've been asked this already, but I want to ask again. Ontario hospitals are in crisis. You have the Canadian Medical Association calling for a national strategy for healthcare workers. When will you step in and start allocating sources to the hotspot areas? You said throughout the pandemic you will offer to help the provinces. ICU numbers are filling up. More and more people are getting sick with this third wave. When will you step in with federal measures? What actions can you take now, Prime Minister?
Every single vaccine dose that arrives in Canada is distributed to the provinces and territories with a small reserve for federal institutions like corrections, according to a formula that was agreed on by all provinces and territories. It included, for example, a carve-out early on for northern communities and remote communities. It was carefully discussed as the right way forward with the provinces and territories. And in order for us to make adjustments to that formula, we will be working, we would need to work with, as we are right now, with provinces and territories. Right now in this third wave, there are hotspots in different parts of the country, particularly in Ontario, but there are also concerns and caseloads rising right across the country. Throughout this, all premiers have had the same goal: get through COVID-19 as quickly as possible. And we are going to continue to work together with the premiers, with all Canadians, to make sure that we're doing the right things every step of the way.
Hello, Mr. Trudeau, Mal Hamidi with the Canadian Press. What the argument with your oldest son was about, and what did you say in your explanation that could apply to those feeling the same way across the country? who feel that they have done their part, but public officials haven't?
Xavier's 13 years old and he misses his friends. He doesn't want to be doing school online. He wants to go outside and play basketball. He wants to, with his friends, he wants to have the normal life that, quite frankly, we all want right now. We want to get back to normal. We want this COVID crisis to be over. We don't want to be told that, no, we're going to have to hunker down for a few more weeks. But the reality is, we know that the best way to get through this is for each of us to follow local public health rules. No matter how frustrated we are, we also know that if we don't, we're putting at risk our summer. We need to flatten the curve in this third wave. And I know in households across the country, parents are having to talk to their kids about restrictions that parents don't particularly feel enthused about either. None of us want to be going through this third wave right now. None of us want to be having to hold back from going outside and enjoying the nice weather and being with our friends and trying to get back to normal as we've been through this incredibly difficult winter. But the fact is, we are in this third wave. It is serious, very serious in Ontario and in some parts of the country, and it could get more serious in other parts of the country. This wave is different from previous waves, in part because the variants of concern are more communicable and more serious. That means the things that we did before might not protect us the same ways. That's why listening to public health advice, following the rules, and hanging in there for a few more weeks, maybe a couple more months, is going to be the way we can get to a summer that is as close to normal as we could hope for. I know we're all frustrated, but we will get through this as long as we give it one last push.
Thank you, Prime Minister. Last question before you have to leave.
Thanks. Hi, Rafi Boudjikanian, CBC News. Prime Minister, we're hearing from Quebec just now that this weekend trucks with megaphones are going to drive around certain neighborhoods to tell people to get lined up for AstraZeneca shots, especially with the Moderna delay. What do you view as your role in convincing other public health authorities and Canadians that AstraZeneca is safe, especially for cohorts under 55? Thanks.
Obviously, we will every step of the way follow the best advice of medical professionals and health experts. Health Canada has reconfirmed that the AstraZeneca vaccine is safe for use. There are side effects, but they are so rare that it is much safer for people to get vaccinated with whatever vaccine is offered to them than to go unvaccinated, particularly in this third wave. We will continue to emphasize and put forward those recommendations. And of course, like always, we will turn to doctors to emphasize that, which I'm happy to do right now by turning to Dr. Tan.
It's Dr. New.
Dr. New, that's right.
Tam
Dr. Tam had to leave. Go ahead. Go ahead, Howard.
So what specific question and point? Sorry, I just wanted to make sure I'm answering the right
It was
part
on
there.
encouraging people to get vaccinated, including with the AstraZeneca vaccine, which Health Canada has reconfirmed is safe.
I think we've repeated it many, many times, not just Dr. Tam, myself, but I think experts and public health authorities across the country. You know, all of the approved vaccines by Health Canada are very safe and effective. I think the proof is in the pudding, as they say. Millions of doses of the AstraZeneca vaccine have been administered around the world. And this rare event is exactly that. It's very rare. Look in Canada. We've had, I think, the one reported case in Quebec. And as I mentioned yesterday at my technical briefing on vaccines, we've actually administered over 700,000 doses, 709,000 doses to be exact. And I'm sure the number is increasing. So that gives you an idea of the rarity of this event. And the fact also is that we can treat this event. Physicians are now getting sort of information and education about how to quickly detect this very rare side event and how to appropriately treat it. And this individual who had the rare side event is recovering. But having said that, look at the 700, almost 710,000 doses that were administered. All those people now have a level of protection against COVID-19 that they didn't have before. So I think I'll just leave it at that. I'm not sure what more we can say. We've been keep repeating the same thing. So there you go. Thank you.
Thank you, Dr. New. Merci, Monsieur le Premier ministre.
Merci tout le monde.
On va donc retourner au téléphone.